Hello everyone, welcome to Neobiotech International Virtual Seminar. Thank you for attending this online lecture, and my name is Gabriel Lee. I'm gonna be the host for today. We're doing online lectures on every Wednesday, as you can see, mostly in English. Sometimes it will be other languages. Please contact your local sales representative for detailed information and registration. We have one lecture left for this month, scheduled as today for second one of VARO guide. In October, we'll have 3 lectures as well, so please don't forget early registration. Languages for 21st day will be Spanish, and for 28th day, there will be Russian. So please do not miss them if you are speaking those languages. For today's lecture, Dr. Sil Park from USA will continue speaking about new guide system as VARO Guide Chapter 2. VARO for your everyday practice. For 1 hour, he will give his idea and knowledge about this new guide system. Please use chat button to communicate with me about any issues other than topic. We'll have a Q&A session after lecture, so please submit your question through Q&A button. Speaker may not answer for all questions because we have a limited time to take all questions. If you have more questions or anything for discussion, you can contact Neobiotech website or Facebook or email address. So, now let's have a Dr. Park to start. Please welcome Dr. Park. Hello, doctor. Are you there?
Hello, Gabriel. How are you?
I'm fine. Thank you for asking. Okay, let me finish my screen share.
Alrighty. Thank you for your great instruction and then introduction too. Hello, doctors. Thank you for joining our international webinars, right? Neobiotech international webinars. Last week, we discussed about the limitation of the currently available, like conventional CAD/CAM guided implant surgery system. And today, and also we briefly discuss about what is the benefit of using the VARO guide and why is we call it a breakthrough solution to overcome the current limitation of those conventional CAD/CAM guided system. So today I'm going to discuss more about in detail how to use a VARO guide in more clinical aspect of it. And then I'd like to share some clinical case with you guys using the VARO guide. So it's gonna take a little bit longer. So I tried to finish on time, maybe a little bit more than 1 hour. So please stay with me. So let me start my lectures. Okay, so let's talk about the VARO guide system. It is a breakthrough chairside hybrid guide implant surgery systems, right? Why I call it a hybrid? It's not totally digital. Some aspect is the analog and some aspect is guide, the digital. So we call this a hybrid system. So let me start. Well, if we do not use a guide, sometimes we have faced this kind of situation, right? The fixture is too close to the neighboring tooth to root, or it is really wrong angle. So we know that guide is quite beneficial to our everyday practice, but why we are not using it? First of all, it takes some time, right? Even though we do the rush case, but usually it takes about 3 to 5 business days. In my practice, usually I make appointment in 2 weeks. So for example, I saw the patient today and I get all those information and then I make appointment in about 2 weeks, right? So it takes some time, right? That is some time limitation. And also we have some issue about the accuracy. Even though all the companies, all those brands, they claim that system is really great and accurate and safe, but still we have some questionable accuracy among those systems. So usually we are using take the impression or using the intraoral scanners, right? Like this, and then we do the extra. If we take the impression, we pour the stone, and then we are using the extraoral scanner, model scanner, and then we make the guide, right? And then once we plan those guide, then with the 3D printing. Everybody thought the 3D printing is very easy and simple, but the truth is once the printing is done, actually we have to do those post-printing procedures. So we have to remove all those support, as you can see on those video clip. And also we clean the inside of the guide itself. So it takes some time, and also it's somewhat is a technique sensitive. When they remove all those the support and then remove all those the excessive amount of the acrylic, sometimes it's going to compromise the accuracy too. So we really need to have a guide system, right? That everybody can understand, easily understand, and then hopefully we can finish within 30 minutes or 1 hours, right? And also, hopefully we want to have some system that any doctors, even the staff can design and then fabricate it. And if you don't have any extra intraoral scanner, then we try to avoid it to pay extra money for those buying those extraoral scanners, right? And then level, we try to avoid it. And also we want to have some more accurate guide system. Yeah, definitely no rocking at all. So in order to achieve those issues, right, I proudly present the VARO guide. VARO guide is easy to understand, right? And then in 30 minutes, we can finish it. We don't need extraoral scanners or intraoral scanners. No level is needed. And then it is quite more accurate than conventional guide. We discussed about those tolerance, right? The gap between those guide and tools, and then gap between the drill and slip, that is has some built-in errors. So, but VARO guide overcome that. So those are VARO guide systems. So let's go a little bit more and more. So first, we need index or impression using the pre-guide like this. And then once the pre-guide made, we took the CBCT and then we do the milling in trail side. We are using the VARO mill. Once the VARO guide is ready, so basically we transform from the pre-guide to the VARO guide like this, and then we do the surgery. So pre-guide means that basically it's a very similar to the quadrant impression tray. However, those impression tray has a specific resin in it that it actually ended up the guide itself. So once we make the once we using the pre-guide and took the intraoral impression and we took the CBCT, and then that information directly goes to our VARO plan system. We made a design, and then we design the guide itself, and then we do the fabricate, that basically milling. So first, in order to get the CBCT with the pre-guide, usually it takes about 10 minutes. Usually it takes about 5-10 minutes to get the pre-guide, get ready intraorally. And with that pre-guide, we take the CBCT. And then planning, if the case is a single posterior case, and within 10 minutes, we can make it using the very simplified, user-friendly VARO plan software. And then also we are using the VARO mill. So trail side, we're gonna make those sleeve, right? And then we do the surgery. So if you are getting used to it, and then once your staff knows how to use it, then even it takes about just 30 minutes from the beginning to the end, and then you can do the surgery. It is a really breakthrough. It will not take a day or 3 days, even a week or 2 weeks. So let's look at the pre-guide more closely. Pre-guide has an individual the package like that, and then you can choose the proper size and shape of the pre-guide. And then pre-guide has, as you can see on the right side, there's a handle, and there is a marker, and there's a specific jig. And also there is a resin, right? The photo activated resin, light activated resin, and also there's a clear membrane on it. Those clear membrane is basically prevent any rocking intraorally. So I'm going to share with you more detail later. So in terms of pre-guide, so far we have 5 different tray. So left side, right side for the single case, and then a little bit longer. So left and right side you can see on the middle. So you can use this guide about when you place the 2 implant or multiple implant in one quadrant. And also if you have a case on the anterior case, then we can use those anterior. So far we have 5 different shape and size of the pre-guide. So let's try to look at it, how to use this. You gently put it and then let the patient bite with the CR position gently until it's fully down. Pretty much that's it. That is your first step. Once that is done, and then basically as you can see on the diagram, those resin is around the tooth, and then it is in right position, and then there is a clear membrane between the tooth and then those resins, so it prevent any rocking resulting caused by the undercut area going to be violated by those resins, right? So before you do that, you're going to have a try in patient's mouth. So you're going to have a trial trays. Those trial trays exactly same size and shape of the pre-guide, and then you can try in patient's mouth, and then you can choose the right one. So those 5 you can choose it. Once you choose the pre-guide shape and size, and then as I showed you before, you can try in patient's mouth, and then we can do the planning. So on your left, you can see those are pre-guide and then resin, and then that is like you're done. And on your right side, that is a final product of the VARO guide. So basically, pre-guide is going to be ended up the VARO guide itself, right? So the key is in the resin. That is a hard material. And this resin is also once secured in, it can be drilled without any issue and heat issue. And also it can be cured intraorally without causing without producing a lot of heat. And also easy to manipulate. That means it's a correctable tool. So on your left side, you can see again, once we put the pre-guided in patient's mouth and then gently put it in and let the patient guide to the close with the CR position as close as possible. Once that position is done, then without changing the position or without taking the guide, you are using the light curing using your just resin light cure unit, right? So usually 30-second, 20-second to 30-second one side. In this case, the buccal side is about 30-second. Once that is done, you can do the occlusal side another 30 seconds, right? That is how it is. Once you take it out, and then you can see those by, it's basically impression. Once the impression is done, then you take those out, and then you're going to one more right curing inside of the tray. So we have to make sure that those resin is fully solidified, fully set. So it takes another 30 seconds, right? So once that is done, there is a little cap on your left side. You can see that is a jig for the milling machine. Once you remove the jig, and then you can see on your right side, there is a clear membrane. So you have to remove it. But sometimes those membrane is quite sticky, and what it was kind of become one body of the resin, then you can leave it alone. That's also fine too. If there's any excessive resin on the posterior area, then you can grind off a little bit, and then you're going to put into the milling machine, and then you're going to begin to the guide. So let's say, look at it. Once you have all those curing is done, you want to put it back to the patient's mouth, right, and make sure there is no rocking. So since because this is impression itself, is there are going to be very little gap, so it was quite stable. Once that is done, then you're going to put some gauze between the guide and the opposing tooth, right, and then let the patient close like that. So that is your final position. Once that is done, then you're going to bring the patient to take the patient to the CBCT machine and take the one CBCT. So you can see that the CBCT is taken like this. Then all your information is done. At this point, as you can see, you don't need any intro or scanner or whatsoever. All you need to have is just a pre-guide impression, and then light curing it, put it back to the patient's mouth, and then let the patient bite with the gauze and CBCT. Pretty much that is it. So once the CBCT is done, and then you take this guide from patient's mouth, and then you can put the solution, the sterilized solution inside of the pouch, and then you can put your guide in it, right? And also you can, in this case, I wrote in the Korean, you can write the patient's information on the pouch itself. So you're gonna keep it while you are doing the planning and also the milling. So now that information, that CBCT information, DICOM information, we transfer to the VARO plan, and then VARO plan, as you can see, we can make the plan. So those software is very simplified and then very user friendly. You can do it. In this case, also, you can change the design, or you can modify the design of those guide itself. So you can make those axes bigger, or you can even on your right side, you can have a C shape, so more accessible the way you can create it. So it is fully customizable. So you can do this in your clinic, right? So then we're going to use a barrel guide. Once barrel guide is ready, as you can see those hole, the sleeve is ready. And also the program itself create those surgical report as you can see on the middle. And then you're going to do the surgery like that. And then one thing that I can share with you is how can we merge those information from the pre-guide to the CBCT itself, right? Those pre-guide has a marker, radiographical marker in it, 6 marker in it, and also when we do the CBCT, it going to produce the three-dimensional the model like that, and then we're going to pinpoint 3 point. And those 3 point, the bigger the better. With this 3 point, and then we using those one of those 3 point from those 6 from the guide, and we're gonna merging together. So basically those triangular shape, as you can see over here, I can share how can we merge it. So in this case, those guide itself is a 6 dot, as you can see on your right side, 6 dot on the X-ray CBCT image, and then it is a merging. Pretty much that's it. So you're going to identify those 6 dots, right? That triangular shape, tripod shape is more than enough to get the actual merging. And also, while you are doing the planning, one easy way is that you can, if you do the posterior single implant case, and then you can simplify your prosthetic procedure too. I showed this last time too. Then basically those software gonna give you a tools over there automatically. Then you're going to look at those the occlusal plane, right? Curve of speed, curve of Wilson, and then overall position, and then overall size. And based on that one, you can use this software to get finalize your implant position like that. So the way we use those software is not really important. So yes, it takes some time. If you try about 3 to 4 cases, and then you're going to feel very comfortable to use it, right? So in this case, the planning is done from the prosthetic aspect, and also surgical aspect is done. And based on that one, we're going to fabricate the guide itself. So in this case, we are using those anterior case, and then also here for the access area, you can fully customize the way you want, all right? And also a great point is we discussed about the offset a little bit, and I'm going to discuss a little bit more later. So this system, you can choose your offset, 9 millimeter, 12 millimeter, 11 and 10 and a half, or 12 millimeter, you can choose it. And also you can adjust the sleeve, the diameter itself. So if you want to make a little bit tighter, you can have a little bit small hole. Or if you want to have a little bit more the room, then you can make a bigger room. So all thing is the customizable. So you can choose the shape and size and based on your preference. So once those planning is done, we can put those information into the VARO mill. That is a small milling machine. As you can see, it is quite small. And also it has quite a amusing and then pleasant because there's LED light. And then when my patients saw it, and then they are quite impressed. So as you can see, this can be placed in the clinical operatory, or if you want, you can put this in the reception area so your patient can see it, and then they're going to be impressed. So once those planning is done, all you need to do is that Baro guide solidified one, CBCT one, then you're going to take that from your pouch and then you can put into the milling machine. Let me share how to put it. So as you can see on right side, you just put it to the guide itself, and now I am transferring the data into the milling machine itself. So it can be either connected through the Ethernet, or you can use your thumb drive as you can see over here. So now data is uploading on the machine. So once the uploading is done, you can simply put the start. Once you press the start button, and the machine itself automatically self-calibrated first, and then it begins to milling. So this procedure is self-calibrating. So that is a 0 point calibration is done. And then once the machine self-calibrated and confirm the position, and it begin to milling your guide. That, as you can see, all right. Okay, so let's move back. So once your guide is ready, then you're going to rinse it with the water and then put into the sterilized solution one more time, and then with the surgical report, and then you can do the surgery like that. So overall, when I compare with the 3D printing conventional guide system and VARO guide system, the time-wise, like intraoral scanning and then impression and production, all those things takes about 30 minutes to 1 hour, right? And also planning, we usually don't do that. Lab tech going to do that, and then guide design, VARO guide is very short. We can do the trail side, but in the conventional one, the lab technician need to do that, right? As you can see. So actual working hours from the lab technician point of view, it takes about 7 hours, around 7 hours for printing one guide and finishing it, or VARO guide, it took about 30 minutes. So there's a big difference. So if you have an in-house lab, you may consider to using the VARO guide to increase your production of your lab too, because as you can see, actual laboring time, working fabrication time is quite big difference, 7 hours versus 30 minutes. So now we discussed about that accuracy before last week, right? When we compare with the conventional one, and then when we compare with the VARO guide, the big difference is the conventional one is we're using the 3D printer and then the metal slip. However, VARO guide, we are using the intraorally taken those guide, and then we are using the milling. So those milling, as you can see, it was quite accurate, and then the resin itself is hard enough, but also it is somewhat elastic. So actually with the VARO guide, we create the zero tolerance at all, right? So basically there is no gap between those guide and then drill itself, so there is no rocking at all. So it's going to create a much accurate result. Then how is it possible? As I told you before, those resin is slightly elastic, flexible. So when you put into with your finger, it's gonna stop. However, if you put it with a 30 Newton centimeter torque with a hand piece, and then it's gonna go easily in, and then you're going to feel very stabilized, and then no rocking movement between guide and then drill. Right. So now let's look at the middle one. This is a conventional one. When we do the conventional, as you can see, there's no rocking movement over here too. And also when we are using those metal slab, it's a quite technique sensitive because the metal sleeve need to be cemented on the guide itself. Sometimes those cement is excessive, sometimes those metal sleeve is not in right position. As you can see, they can cause a little bit of the error too. So those things we can prevent with using the VARO guide from the very beginning because we don't have to worry about that, right? So VARO guide, as you discussed it before, there is a no metal sleeve and resin itself is a guide itself, the sleeve itself, right? And then we can use those resin as a sleeve, and also we can control those the uh, diameter of the sleeve. So you can make it a little bit tighter, or you can make it a little bit loose, or we can control those offset the thickness of the resin itself, the sleeve itself, then it's gonna adding our more saved one. So here, as you can see, this is quite tight, right? You can see. So as you can see in the video clip, there is a no gap whatsoever. So it was very tight. So that is a great breakthrough of this VARO guide to increase the accuracy by decreasing the tolerance, the gap between the guide and drill. That is a great point, right? And also depend on your region and then country. Our VARO guide system has an open library, so not only the Neobiotech system, in very near future, you can use all other major implant system too. So VARO guide is, yeah, I hope you can use a Neobiotech Fixture 2, implant 2, but also you can use any major implant system using the VARO guide, so you can place those implants as accurate as possible. That is a great thing. So now, as I told you before, guide hole, the sleeve diameter itself is controlled. So you can see over here, I'm changing the diameter. So I can make it a little bit bigger, I can make it a little bit smaller, right? Even the 0.001 millimeter accuracy. So depend on your preference, you can easily adjust it. That is a great part of it, as you can see over here. So no matter what system, what fixture system you are using, it depends on your surgical system, we can adjust it, and then VARO guided system basically open to all other implant system too, right? And then we briefly discuss about the offset over here. Offset is basically thickness of the guide itself, right? So far, those metal silicone, we usually start with a 9 millimeter is a fixed one. Then if we need, then we can add a 1.5 millimeter, another 1.5 millimeters right there, right? But problem is that even though we increase the offset, but the sleeve length itself is still 3 millimeter because we are using the metal sleeve. So actually increasing the offset is not really helping us in terms of stabilize the drill itself. However, VARO guide system, if we increase the offset, that means whole those offset going to be your sleeve length. So that means your sleeve is going to be a little bit longer, right? Then the drill is not rocking anymore. So that is a great aspect of it. Like that one. So the video clip shows that how can we control the offset. On the right side, in the bottom one, you can see that very easily you can change your offset. So in this case, your neighboring tooth is quite high, so we can use a 12 millimeter offset. You can choose it, and then depend on that one, and then your guide system automatically program going to adjust those thickness of there. Then you can use the way you want, depend on your clinical situation, like that. So it is quite easily you can adjust it. So now I'd like to share one clinical case. In this case, I'm trying to put the second molar over here with sinus elevation too, right? So in this case, we can do with the free hand, right? Well, we can use a conventional way, but let me share with this video clip with you guys how to use a VARO guide using, and then also sinus elevation too. So on your left side, you can see the completed VARO guide system with the one sleeve, right? So now we're using the trial tray, and then make sure the tray is fit in that area, right? So then we choose which pre-guide we are using it. Once we choose it, and then we open that exact shape and size of the pre-guide, and then we put it in patient's mouth. First, gently put it in, let the patient bite with the CR position, and then, as you can see over here, light curing it. So 30-second buckle, 30-second occlusion, and take it out, gently take it out, and then if you want, you can cool down a little bit, and then you can put in patient's mouth back, and then you can do the another light curing it. However, nowadays we improve our resin, so the resin is not generate the heat anymore. So now once this curing is done, as you can see over here, we are using those membrane, right? And then make sure it's fit in patient's mouth and put into the patient with the gauze and then CBCT. And then take that from patient's mouth and write the patient info on the pouch with a sterilized solution on it, and then sterilizing. And then with that info from the CBCT, we begin to planning it. And then we fabricate those guide itself. Once that is done, then we take the pre-guide and install into the VARO mill. So again, we transfer the information. Once it's uploaded, we can simply put the start button. Okay, hold over there. Sorry about that. And then once that is done, and then we take it out from the milling machine, put in the patient's mouth, and then we begin to do the surgery using the VARO guide surgical kit. If you have a Navi guide surgical kit, still you can use it. So using the VARO guide and then using the VARO guide surgical kit. So we are doing the tissue punching right now. And then we do the bone flattening. And we do the point drill. All right. And then we begin to do the osteotomy little by little. But we know that this case we need the sinus elevation too. So all those things basically planned, right, in terms of the length. So in this case, we are drilling without perforate the sinus. Now we take the guide out and we are using the SCA kit of Neobiotech, and we are begin to do the elevate the sinus membrane as safe as possible. Once the sinus wall floor is broken, and then we adding lift the membrane a little bit, and then bone graft a little bit, and then we do the final drill for the diameter of the implant. And then now we are placing the IX3 implant. So IX3 implant is placed using the VARO guide, as you can see over here. Right, so once the fixture is in, and then you can do the final torque with a manual wrench, and then get the right position, and then also you can check the torque, as you can see over here. The torque is about 40 Newton in this case, because we achieved the bicortical fixation using the, as you can see over here, using the sinus, the cortical layer too. So this is end result. So as you can see in this case, VARO guide, we can use a simple case, but also we can use a sinus elevation case too, right? In this case, we are using the SCA kit, but good news is recently Neobiotech, we begin to produce, and you can have those, the VARO guide sinus kit too. That means without removing the VARO guide, you can use the sinus elevation, so guided by the guide itself. So it was much easier and safer than before. right? So this is the end result. So once placement is done, we put some healing abutment and then without any flap surgery. So very clean and quick. In this case, on the right side, upper right side, left side, the patient has a root tip leftover, you can see over there, right? Let's see how we handle it. In this case, is the second molar very difficult to access to it. So when we make the guide design, instead of just a hole, we have those C-shape opening. So it basically is a lateral opening. So intraorally, you can approach that area much easier, right, without opening the patient mouth too big, right? And also this case, we are using the aqua way, so aquatic pressure way to elevate the sinus 1, 2. And then once we elevate the sinus, and then we place the implant, as you can see over here. So in this case, extraction and sinus elevation with the aquatic pressure and then implant placement, everything is done using the guide too. So in this case, over here, patient came to the office with a fractured root. So as you can see, half of the fracture vertically, the root was fractured up, and then we planned it, as you can see, using the VARO guide planning system. So once we finalize those surgical plan based on the tooth position, right, in this case, so this is an immediate placement case. Now we take the impression and the VARO guide is done, and then we are taking the tooth out. So once the extraction is done, and then good thing is once you have those VARO guide, you can add those resin again. So once extraction is done, now you have a hole over there, and then right after extraction, you can add a little bit of the resin, and then you can put it back, and then you can make the another guide to adjust it. And once that is done, and then you're going to the milling for that one. So another great thing of the VARO guide is that this one is really, really convenient whenever you have a immediate placement case, right? So as you can see over here, the product, final guide is ready. So bottom line is, you know that you're gonna extract that tooth and you're gonna place the implants right after the extraction. Then what you need to do is take the VARO guide, pre-guide impression first, right? And then gap plan is done. And then you're going to extract the tooth, and then you're going to add a little bit of the resin on the existing pre-guide and then curing it, right? And then you put this thing into the resin, into the milling, VARO mill, and then VARO mill going to make the guide for you, right? And then you're going to do the surgery, as you can see over here. So here we are using the Navi guided system instead of the VARO guide system. Still, you can use it. So right there, you can see the sleeve is quite tight, right? So there is no rocking at all. And then begin to do the initial drill, as you can see over here. So now the final drill is, so getting to the final drill over there, right? And then now we're putting the implant fixture itself. And then once we, in this case, we are using the hand tightening, and then we do the manually, we're gonna tighten it, right? Get the right vertical position. And then also we're going to check the torque itself. So once that is done, basically your surgery is done. Right, so in this case, we achieve about 30 Newton centimeters. That was great, right? Now we take it out, those the VARO guide and then the driver. So case is done. So this is the immediate placement case using the VARO guide. So now you can see guide is right position. Now the trimming the excessive bone around the fixtures. This is, we are using the accessory kit. So you can, this is optional, you can do it. So basically we removing any soft tissue or excessive bone around the fixture. So very gently do that. And then we took the one X-ray, make sure those implants is in the right position. As you can see, it's a quite great positions. And then we put some healing abutment, right? That fit to the size itself. And in this case, we don't need any bone graft because there's a very little gap. But in this case, before we putting the healing abutment, a little bit of the bone graft, the buccal aspect of it, so without putting the membrane, what we can do is we can using the healing abutment as a gap on top of the bone graft itself. So whether you're using the bone graft or not, it's like 1 millimeter jumping space or not. It's totally depend on your clinical judgment. So this is final. So actually, this is a final prosthesis zone, and then bone, everything is really great. All right. So now let me share that the anterior case. The anterior case is a quite burden, right? Because it has a lot of the issue we have to think about it. So with the VARO planning it, you're going to make the proper position, right? The way you want, right? After you take the pre-guide and then CBC is done, you are planning this, as you can see over here. Right. In this case, I know that this case is more like the screw type, right? But also at this point, you can choose whether you're going to use a screw type or a cement type, right? That is also possible. So when you are doing the planning, surgical planning, but also you are doing the prosthetic planning too, that is a great aspect of it, right? And then it's going to tell me how much the space we have from the prosthesis to the fixture itself, and then we're gonna look at those the angulation too. Right. So for those single case, it looks very complicated. However, all you need to do is about 2 to 3 cases later, you can easily control all those buttons. So all you need to do is basically with the mouse, you do the left click and right click. That's what it needs to be done. So once that is done, and then we do the surgery. So over here, tooth number, the central incisor is getting the site, and then now we are doing the initial drill, as you can see over here. So one by one, step little by little, we do the point drill, right? Now you can see the point drill position. In this case, we are flat first, right? And then we are using the guide. In this case, we possibly need a bone graft or soft tissue graft, and then you can use that procedure too. So if it's not necessary, you don't have to open the flap. So that is totally up to you. So now let me jump a little bit. So now the whole those procedure is done, right? The osteotomy is done. You can see there's a little bone left on the buccal area. So we might need a bone graft over there, right? So we evaluate the osteotomy itself. Now we are putting the implant. This is IS3, and then we are using as a hand. With a manually we put it in, we tighten it up. So once you tighten it up, once you feel the resistance, and then you can use a manual hedge, torque wrench, and then you're going to place it. And then where you're going to stop. So for the surgical report, you're going to see which line you're going to stop. In this case, it needs to be the flushing to the top line. You can see that, right? So now once that we reach the line, the vertical position, as you can see over here, so it's going to be flush a little bit deeper and deeper until the top portion is flush with the guide itself, and then you can choose the check the torque. You go a little bit deeper, as you can see over here. So slowly we can move in, and then we finish the placement of the fixture using the guide. And then the torque is about 15 Newton centimeters, right? That is totally fine. And then we turning back a little bit, and then we just loosening the torque a little bit less, and then we're aiming about 40 Newton centimeter. That's what we want, right? So once the position is done, then now you can see implant is in. Let me go in. So now this is the abutment, temporary screw, and the one screw is done, and then let me just jump it, and then we are using those temporary screw cylinder to create the temporary prosthesis over here, right? Okay, so once the temporary prosthesis is done, and then we put the healing abutment and put some bone graft on the buccal aspect of it with the healing abutment in it. And then once the bone graft is ready, and then we're suturing out. Once the suture is done, as you can see over here, and then we put our screw type, the temporary crown back. As you can see over here, we're pushing the soft tissue a little bit back in the right position, right? And then we tighten up about 10 Newton, 10 to 15 Newtons. So in this case, this is an immediate loading case with a bone graft. So in the anterior case, right? This is case done using the VARO guide, right? Like that. And then finally, once the position is done, tightening is done, and do the occlusion check, as you can see, and case is ready, and we're going to see the patient in the follow-up. So VARO guide, as you can see, we can use it for the immediate placement, and in this case, we can use immediate loading, and also we can use VARO guide for the sinus elevation too, case 2, right? There's many ways we can utilize it. This is a follow-up case, so follow-up pictures of the case over here. This is right after surgery, about 1 month, and the final prosthesis was pretty, I don't have any complaint about it, right? Now let's discuss about more a little bit GBR case over here on the mandibular posterior right side and the maxillary left side. Right. In this case, we are doing the sinus elevation with a 2 implant multiple case over there. Right. As you can see over here, in this case, we can do once we flap it, and then we just do the guide the initial drill over here. Right. And then finish the drilling over here, and then place the implant. And then from the very beginning, we know that the vocal aspect is a very little bone. So in this case, we need a GBR. That's why we, even before start, we open the flap and then we place the implant first, and then we do the GBR later. As you can see, and also sinus elevation too, and put some GBR on the vocal aspect over it, put some membrane over it, suturing it, and then this is the final result, right? And then mandibular posterior case, as you can see over here, 2 implant is placed, plan to place, and then also both of implant has a vocal aspect of it has a big dizziness, right? We know that from the very beginning. That means once we place the implant in the right position, they're gonna be the thread exposure, right? And then we're going to put some the bone graft and the membrane over there. So we plan it from the very beginning. Right, so once we opening the flap, and then we put some VARO guide in it, and then we place the implant, then you can see that about the thread was exposed, and then we scoring it, and then for the blood supply, and then we put some the titanium CT membrane over there with the bone graft and suturing it, and this is the final result over there. So VARO guide is also used for those even membrane involved those GBR case too. This is a great use of that. Now another case is, let's look at the maxillary posterior area too. This one is quite thin, extraction is done previously, however, left of the bone is quite little. In this case, when we use only one guide, this case using the 2 VARO guide to stabilize it. In this case, why we are using the 2 VARO guide is because it has only premolars, right? And then those 2 molars is missing. So if there is not enough support when patient bite, it can be rocking. So it's in the wrong position. So prevent those movement of the VARO guide or pre-guide during those impression taking. That's why we are using it one. So first we're going to do the upper one as usual, and then we put the lower VARO guide tray in the bottom one. So we stabilize it. And then, as you can see over here, and then we're curing both of them, right? In this case, we can do upper and lower together. So upper has a 2 implant and lower has 1 implant. So in this case, without taking CT 2 times, only 1 times with the 1 VARO guide on the top, pre-guide on the top, 1 pre-guide on the bottom. So you can do 2 implant maxillary and 1 implant mandible at the same time with a 2 pre-guide, right? So maxillary 2 case was placed, as you can see, right? So with the VARO guide over here. So over here, the difference is that guide itself has vocally opened quite a bit, right? So vocally opened quite a bit, so it's much easier to access it, as you can see over here, right? The total 6 implant was placed over here, right? And then also bone grafts over there, and then now we place a fixture, and then right place the fixture, we are using the osteoactive to So rejuvenate the implant surface to increase the bone stimulation and then generation on top of it. This is how we are using the osteoactive. So by using this, we are removing the old carbon on the surface of the bone. So now it has a much more possibility and the characteristic of the bone regeneration and then bone maturing on around the implant surface, right? And then this one, we put it back to the case over here. As you can see, then now we place the implant over here. Like that, let me just jump over here. So all those three implants placed, and then once the implant placed, and then put some bone graft over here, as you can see, and also lower implant. So 1, 2, 3, and then with the sinus elevation, and the lower, all the case is done. All right. So this is some snapshot. The exposure on the buccal area, put some bone graft over there. I think it's some snapshot over there. So 3 implant is done, and the mandible, the 1 implant is done for this case. All right. So if you want to use a VARO guide, you have a couple of options. Depend on your country, depend on your dealer or the sales representative. What you can do is you can buy all those systems. So pre-guide and then VARO software, VARO plan, and also VARO mill. So you can do everything in your office. Or if you do not want to plan yourself, then one easy way is once you take those with the pre-guided CBCT, send this case to your local lab. Well, the neo implants, the sales rep, and they're going to process it within 1 day. They're going to give you the software. They're going to give you your final guide info. Then you simply download that info and then put into the VARO mill, and it's going to fabricate milling your final VARO guide. Well, if you do not want to use VARO mill milling machine in your office, the other way is also you can just use the guide, pre-guide itself, and then planning itself. Once your planning is done, and then you send your planning the file to the lab, and the lab going to fabricate using the milling machine, the VARO mill, and then they're going to send you. Well, if you do not want to even do that, you simply buy the get the pre-guide and then get those information and send to the lab, and then lab going to do everything is done. So bottom line is you can do everything in 30 minutes in your office by yourself, or you can do 1 day, 1 hour, or 1 day, or 2 day course, right? So it's gonna give you great freedom. When my patient comes in, right? If patient is really in hurry and express way, then usually I can do within 1 hour, I can do the surgery from the very beginning to the end. Or since I have a next patient waiting for that patient, right? So then what I can do is I get those info and then see all the other patient, and the next day afternoon, I see the patient. So basically from the patient point of view or doctor's point of view, first visit, you get all those VARO guide, the pre-guide information, and the next day you do the surgery. So you don't have to wait about 1 week or 2 weeks. And also the great aspect of it, as I told you before, if your VARO guide is something wrong, and then you can add, you can adjust it, you can fix it. That is like resin, so it's a great aspect of it. So again, VARO guide system, we don't need any intraoral scanner. Well, you don't need a model scanner, right? And then there's a very, since everything is done within one CBCT, so much more simplified it. You don't need to buy a 3D printer, and then you don't need any lab work, and then it is much more accurate and reliable comparing to the currently available conventional CAD/CAM system. That is a great aspect of it, right? So VARO guide system again is a chairside instant CAD/CAM guide system, and then done by the doctors and staffs. And also in-office chairside planning and milling is possible. Milling time is 10 minutes, but nowadays you can finish in a single case even 7 minutes. And then total working time is about 30 minutes. That's a great aspect of it. All right. So yep, this is what I prepared so far. So I'm afraid I moved too fast, but I just want to show as many clinical pictures as possible. Okay, that's why I just a little bit speed up. All right. Okay, Gabriel.
Yes, doctor.
All right. Could you take over?
Okay, thank you for the lecture. It was a very awesome lecture. and I'm watching the Q&A box, and so far, yeah, we don't have any questions.
So if you have any question using your Q&A button, so give me some question, or you can send any question to your local sales representative, and then I'm going to answer for that as fast as possible. All right. Other than that, and then thank you so much. So Gabriel, please take over.
Okay, I'll do it. Thank you. All right, again, thank you very much for the lecture, Dr. Park. And if any question, please leave it in the Q&A box, or later, please leave it on the Facebook page or our website. Okay, we'd like to ask some feedback from attendees about today's lecture. There will be an extra pop-up screen with the 5 questions, so please share 1 minute for us. We'll always try the best to improve the quality of webinar for your satisfaction. This lecture will be uploaded in our website with a YouTube video sooner or later. Please stay connected with Neobiotech social media to communicate with us more. Search Neobiotech in Facebook and YouTube, then to like or subscribe to get more information. And for the next upcoming webinar, will be on 14th October next month. It's about after 3 weeks. The next lecture will be about peri-implantitis. Please check your time zone for local areas. If any question or information you need, please contact us via those information. And don't forget, you can get more information on our website or social network service. Again, thank you very much for attending our webinar today. We hope all of you enjoyed this time. Please have a good day or good night. See all of you next time again sooner. Thank you. Bye-bye.